Coronary artery bypass surgery is, as the name suggests, when you get a blockage in your coronary vessel. To treat that, you have two possible ways. One is to put a stent and push that narrowing or stenosis open. Another option is to actually bypass it. And in coronary artery bypass surgery, what we do is we bypass that blockage. We leave that blockage in place, but we go beyond that blockage and feed that vessel with a new inlet for a fresh blood supply.
There are three major blood vessels that supply blood to the heart. The left coronary artery, which divides into two major branches, and then the right coronary artery. And patients can develop blockages in those arteries that lead to heart disease. Coronary bypass surgery is utilizing either a vein or an artery to bypass the blockages. And the bypasses are usually placed in a location that is far beyond the blockage, thereby not only treating the blockage that's occurring at present, but also treating future blockages for most patients.
You do as many bypasses as necessary to achieve what's called a complete revascularization, meaning that you have bypassed every single significant or sizable vessel to all major territories of the heart.
Cleveland Clinic, for the most part, invented coronary bypass surgery back in the 1960s. Mason Sones was a cardiologist who happened upon coronary angiography and developed really the first coronary angiogram. And together with his surgical colleague, Rene Favillaro, they worked and were able to do the first coronary bypass. And coronary bypass surgery had a tremendous history here at the Cleveland Clinic from the early 1970s. We did far more coronary bypass surgeries here than anywhere else in the world. Coronary artery bypass surgery is certainly the most common operation that heart surgeons perform, and it's actually the most common operation among heart surgery programs in the country. But that doesn't mean that it's the same operation for every patient. Every patient needs a tailored approach to coronary revascularization. So there are multiple approaches for coronary artery bypass surgery. The standard approach is utilizing a full sternotomy, which is a full splitting of the sternum. And the surgery can be performed either utilizing the heart-lung machine or what's called off-pump technique, and thereby we use stabilizers to stabilize portions of the heart to do the bypasses we need to do. We can also perform minimally invasive coronary bypass surgery. A lot of those can be performed through a very small incision between the ribs.
We never want to compromise quality for cosmetics, because our objective is not to have a perfect immediate outcome. Our objective is to have long-term success.
When we look at performing bypass surgery, we use either the mammary artery, a radial artery from the arm, or a portion of the saphenous vein from the leg. Now, each of these bypasses lasts a certain length of time. They don't last forever. The mammary artery by far lasts the longest. It's one of the only arteries in the body that really does not develop atherosclerosis. So multi-arterial grafting is by far the best strategy for performing coronary artery bypasses for patients because it gives the most long-lasting effect.
Not only do we have high volume cardiac surgery practice, but the patients we get here are very high-risk patients. We accept patients from all over the country, in fact from all over the world. Many of them have seen one, two, or more surgeons that have declined to offer those patients surgery because of their high risk. And the surgeons here are very comfortable dealing with those patients.
The Cleveland Clinic has long been a leader in reoperative coronary artery bypass surgery, that is, new coronary bypasses in someone who's had bypass surgery before. We do the largest number of those cases yearly than any other center.
What we do to achieve excellent results is having a great team approach. We have excellent surgeons, we have excellent support, and we use grafts and techniques that ensure that the patient will have not only excellent short-term outcomes and very low complication rate, but also excellent long-term results.
I think a lot of patients before heart surgery don't actually fully understand how poorly they feel. And what's rewarding is seeing them return to what they were, seeing them really be able to enjoy life again.